How did Salk and Sabin's polio vaccines differ? Imagine a time when polio was a shadow over children's lives, causing paralysis and fear in communities everywhere. In the 1950s, two scientists, Jonas Salk and Albert Sabin, created vaccines that changed everything. Their approaches were quite different, and understanding those differences helps us see how science fought this disease. Jonas Salk's vaccine, introduced in 1955, was made from poliovirus that had been killed with formaldehyde. This meant it could not cause polio. It was given through injections directly into the muscle, which made it very safe. The vaccine worked by prompting the immune system to produce antibodies in the blood, giving protection against the virus. Because it used dead virus, there was no chance of causing the disease from the vaccine itself. But it did requiring trained medical staff to give the shots, which made mass vaccination campaigns more complex. When Salk's vaccine was introduced, polio cases dropped sharply, giving hope to millions. On the other hand, Albert Sabin's vaccine, which came into widespread use in the early 1960s, was quite different. It used live but weakened or attenuated poliovirus strains. Instead of injections, Sabin's vaccine was taken orally, often on a sugar cube or as drops. This made it much easier to give, especially in large-scale immunization efforts and in places with limited medical resources. The live virus in Sabin's vaccine mimicked natural infection more closely, which meant it stimulated immunity not only in the blood but also in the intestines. This intestinal immunity was key because it helped prevent the virus from spreading in communities. The main differences between the two vaccines are the type of virus used and how they are given. Salk's vaccine contains killed virus and is injected, while Sabin's contains live weakened virus and is taken orally. Salk's vaccine mainly triggers antibodies in the bloodstream, protecting the individual, but Sabin's vaccine stimulates both blood and intestinal immunity, helping stop the spread of the disease. Safety was another big difference. Salk's vaccine had no risk of causing polio because it used dead virus. Sabin's vaccine, however, carried a tiny risk that the weakened virus could revert to a dangerous form, which made some countries cautious about its use. The oral vaccine's ease of administration made it perfect for mass campaigns, especially in developing regions. This difference helped accelerate the global effort to wipe out polio. The legacy of these vaccines is immense. Salk's vaccine was a giant step forward, giving hope and protection to millions. Sabin's oral vaccine made it easier to reach more children, helping to reduce cases even further. Together, they transformed the fight against polio from a terrifying threat into a preventable disease. Their innovations reflected the spirit of scientific progress and public health dedication that defined the era.